Choosing the best antibiotics for racing pigeons. Racing pigeons are bred for speed, endurance and homing ability. However, like any animal, they are susceptible to various bacterial, fungal and parasitic infections. Having the right antibiotics on hand to treat illnesses quickly and effectively is key to maintaining a healthy flock. But with so many antibiotic options available, how do you choose the most appropriate medications? Here are some tips on selecting the best antibiotics for your racing pigeons. Considerations for antibiotic selection. There are a few key factors to think about when choosing an antibiotic for pigeon infections. Spectrum of activity. You want an antibiotic that covers the most likely pathogens based on the symptoms and organs affected. Having a broad-spectrum antibiotic for initial therapy is useful when the cause is unknown. Route of administration. Antibiotics come in various formulations like powders, tablets, injectables, etc. Choose one that is easy to properly dose in your birds. Drug interactions. Be aware of antibiotics that should not be mixed together due to antagonism, like tetracyclines and penicillins. Resistance patterns. Look up local or regional data on antibiotic resistance in isolates from racing pigeons to choose effective drugs. Individual variations. Consider factors like age, medications used, and pre-existing conditions that may influence antibiotic selection for a particular bird. Withdrawal times. For antibiotics used right before races, look for medications with the shortest withdrawal times to avoid lingering tissue residues. Recommended antibiotics. With those considerations in mind, here are some excellent antibiotic options for common infections seen in racing pigeons. Respiratory infections. Doxycycline, broad-spectrum cover against Mycoplasma, E-Coli, strep, staph. Tilmecicin, highly effective against Mycoplasma and E-Coli. Enrofloxacin, fluoroquinolone with good respiratory tissue levels. Gastrointestinal infections. Tylosin, macrolide active against many GI pathogens like E. coli, Salmonella, etc. Trimethoprim sulfa, good broad-spectrum activity against gut bacteria. Furazolidone, useful for stubborn salmonellosis cases. Wound infections. Cephalexin, first-generation cephalosporin effective for skin and soft tissue infections. Amoxicillin clavulanic acid, penicillin/beta-lactamase inhibitor combo to cover staph. Enrofloxacin, excellent penetration into wounds and tissues. Eye infections. Neomycin/polymyxin B, topical antibiotic combination to treat conjunctivitis. Gentamicin, injectable aminoglycoside that penetrates ocular tissues well. Ciprofloxacin, fluoroquinolone eye drops for severe infections. Prophylactic use. Doxycycline, in water during stressful periods to prevent respiratory outbreaks. Sulfadimethoxine, frequently alternated to head off gastrointestinal illnesses. Key points on administration. When using antibiotics in your pigeons, give the full therapeutic course to prevent resistance from developing. Properly time doses and calculate amounts carefully. Isolate and treat any visibly sick birds immediately. Ensure adequate hydration and nutrition to support recovery. Avoid overuse of any single antibiotic class to minimize resistance. Work with a veterinarian for culture sensitivity testing when needed. Be observant for potential drug interactions and side effects. Using the right antibiotic for the situation, maintaining proper dosing, and practicing good loft hygiene and husbandry helps keep racing pigeons in peak condition. Being prepared with the most effective medications for common infections gives you the best chance of prompt treatment and recovery. Consult with an avian veterinarian to develop customized antibiotic usage protocols for your flock. There are many reasons to buy my racing pigeon method. Here are some of the best reasons. You will get excellent results. It's a very simple system to use. It's affordable. I have had over 400 first prize winners. It's adaptable to any situation. You can use it with any racing method, natural, widowhood, young birds. It's a very effective method. There is no need to spend a lot of money on fancy pigeon products. It's a reliable system and it is foolproof to use. Professional athletes, race horses, take the same products. There is science behind this, not just hearsay. It is all to do with red blood cells and oxygen in the blood. Without that, a pigeon will not race well, or an athlete will not win a race. If he has low oxygen in his blood, the above is fact and is 100% science. There are a few things you can do to improve your chances of winning at racing pigeons. One of the most important things is to learn as much as you can about the sport. You'll need to know the different types of pigeons, how to train them, and how to race them. Another key factor is practice. You'll need to be able to fly your pigeons competently in order to win races. And, Of course, you'll need to have the funds to invest in racing pigeons and other racing equipment.